It's really helpful to be able to do a basic physical exam and to be able to collect vital signs for your pet. This table shows typical normal values, but it's most helpful to practice frequently and keep a log to monitor for changes and trends. A lot of pets with breathing or heart problems will have their respiratory rate checked multiple times a day. If you notice changes in your pet's energy level, appetite, water consumption, etc., that can be a sign of an early problem. The first thing I usually do is, hey buddy, how's it going? Sit. Do you know any tricks? Shake off. Good job. And then that way you can just see, are you up, about, responsive? Do you know any words? Can you hear? Does it hurt to lift your hand? Or to sit? Okay, good job. The mucous membrane color, which is the color of the gums, be nice and pink unless they're pigmented. If you ever see pale gums, like white gums, that's really serious and that's an emergency. Capillary refill time, when you push your finger on the mucous membrane, it turns white. How long it takes the blood to come back into those blood vessels. There are a few places to feel a pulse, but I think these two are the easiest. Femoral pulse can be found by taking your index finger and your middle finger and feeling along the inside of the thigh, along where the inseam of your jeans would be. The dorsal pedal pulse can be felt just below the back ankle on the top of the foot, kind of where the shoelaces would be. To get a heart rate or a pulse rate, you will look at a clock and count how many beats there are in a minute. If you can't find the pulse, sometimes you can actually feel the heart beating if you feel along the chest wall. A lot of times it's easier to feel on the left-hand side. Watch their breathing, and their chest should just rise and fall softly and gently with no effort. Respiratory rate, so you just count how many times the chest rises and falls in 1 minute. Temperature, usually we take a rectal temperature. We have thermometer probe covers. So just put that on like that, and then we'll dip it in the lubricant. Gently lift the tail, don't pull on the tail. Dogs hate it when you pull on their tail. And then don't stick it in there until you actually see it. You want to make sure that the abdomen is nice and soft, and you can kind of gently push on it and make sure you don't feel anything uncomfortable or too hard. That should always be nice and soft. If you notice it getting too large or being painful, that could be a sign of a problem. Check the ears. They should be pretty clean and not red or uncomfortable. Good job. When you look in their eyes, the whites should be white with not red and not hazy or painful or swollen or anything like that. It's a good idea to regularly check all of the places where the peripheral lymph nodes are. Feel underneath their jaw, and there's two little balls that you can feel, and those are the salivary glands. And then right next to those are the submandibular lymph nodes. These are the prescapular lymph nodes. These lymph nodes in the armpits are axillary. And there's lymph nodes just behind the knee. And in the groin area. When you're looking at them, you should make sure that they're not too thin and that their bones aren't sticking out too much, and they're well muscled. You want to look at their coat to make sure that it's nice and healthy, and always feel around and make sure you don't feel any lumps or anything abnormal.